There are a number of regenerative medicine techniques that are currently being used at NorthShore. One of the most common ones is actually using either donated tissue or live tissue from a patient's own body and use that to rebuild or regrow tissue such as ligaments or cartilage or bone. I first met Megan Kirkpatrick because she was referred to see me by Dr. Brad Dunlap, who's one of my partners. Megan had actually had a bad accident where her kneecap had dislocated, and actually almost half the cartilage of her kneecap had been destroyed.
I've had issues with my knees ever since the age of 9. It's been popping out of place for as long as I can remember. Even just like walking down the stairs would pop out, or running. Sometimes it was really bad that I had to get rushed to the emergency room. It just happened so much, it's something that had to be done.
In Megan's case, what I wanted to do is try to minimize the downtime for the patient and use something that's been demonstrated in a number of research studies to be pretty reliable for this particular kind of injury on the kneecap. This is a single-stage procedure. What this involves is actually taking small pieces of donated cartilage in a suspension of a gel, placing that into the area where the cartilage was damaged in her knee. The forces around the kneecap can be up to 2 to 4 times your body weight, and when you're running or jumping, that can be up to 6 to 8 times your body weight. If we can get the body to regrow its own cartilage, many studies have shown that that's a very durable result. And so there won't be a need to try to replace it again with some sort of metal or plastic.
I think the regenerative tissue idea and process is quite fascinating when you really think about it, that my own body can help itself heal. When I first had the left surgery done, it was a more typical one. It didn't have the regenerative tissue. It took about 4 months to recover from that, and then 3 months after that, I had the second knee surgery done. And that was with the regenerative tissue. It cut my recovery time in half. I was able to return back to work within like 2 months. It'll be interesting to see what the difference will be between the left knee and the right knee.
It's been a really exciting time in regenerative medicine, and there's been a lot of breakthroughs that have been made. Obviously, there's still a lot of work to go. The funding from the auxiliary of NorthShore will be really important for us to be able to take our work to the next level. One of the areas where we have a lot of interest and have started some preliminary work in is in the use of injectable scaffolds. You can actually take cells and growth factors and inject them in a gel form into an area of the body like cartilage or a muscle that has a piece missing, and then inject it and allow the body to heal itself. Another area that the auxiliary of NorthShore funding will be very helpful for us is actually in conducting a lot of patient-related research into such areas as stem cell research for the use of spine surgery and spine treatments, and also in the use of various types of autologous growth factors. Basically, your body's own proteins and enzymes that can be taken from a small amount of a patient's own blood, concentrated so that all these healing factors can be used right where they're needed the most to help a body to heal itself.
I am happy to be going to walk. Really, it's amazing what things are taken away from you when you're on crutches and you have these surgeries. So I'm very pleased with being able to go back to my normal life.